Hi, this is Dr. Natalie Burr with Little Rock Pediatric Clinic. Today I am interviewing Elizabeth Oyler. She is a nurse and also a lactation consultant. And we're going to talk today about just some breastfeeding basics and some commonly asked questions, definitely that I get in clinic from expecting moms and new moms. So, Elizabeth, I'll let you go ahead and introduce yourself and then we'll get started.
Hi, thanks, Dr. Burr. Like she said, my name is Elizabeth Oyler. I am a nurse and a lactation consultant at Baptist Health. I work in our inpatient hospital setting as well as our outpatient lactation clinic, which we call expressly for you. So thanks for having me today.
I'm excited. So, one of the first questions, and just kind of from the beginning, is okay, so why breastfeed? What are the benefits for mom, for baby? Why do it?
Right. So there's numerous benefits. We could go on and on. But primarily, one thing that I really try to focus on when I'm helping my moms and families is that breastfeeding is perfect infant nutrition. So, yes, there are lots of other benefits. We see that breastfed babies tend to be healthier, they have less ear infections, less GI infections. But when it really boils down to is that they're human babies and human milk is perfectly designed to meet all of their needs. So, again, that's one of the benefits that I really like to stress. But there are lots of benefits for mom as well. We know that she has a reduction in the likeliness of developing breast cancer, ovarian cancer. It reduces the likeliness of developing type 2 diabetes later in life, as well as heart disease. So there are long-term health benefits for the mom. Those long-term benefits also carry over to the babies as well. We know that breastfed babies also have a reduction in the likeliness of becoming obese as adults and developing type 2 diabetes, which is a big concern for our medical community right now, as we're starting to see so many more families affected by diabetes and obesity.
Definitely, yes, I definitely see that in practice. And that's, an entirely different topic we could talk a long time about
Sure.
as
Yeah.
far as, obesity, type 2 diabetes. But good to know there's something just from the beginning of life that moms can do, not only for themselves, but for their babies to decrease the risk there. So another thing is, one of the things I hear commonly as far as, getting started with breastfeeding is in those first few days, how do moms know that their baby's getting enough? What are some of the signs and some of the things moms can do early on to know?
Well, one of the most beneficial things that you can do from the beginning is keep your baby near you and feed on demand. Hopefully, the hospital that you'll be having your baby in will start what we call skin to skin. So immediately after birth, having your baby on your chest and near you, and letting them feed in those first few hours. We know that babies feed well in the first few hours after delivery, and it's a great way to kind of get breastfeeding off to a good start. Um, we like to promote what we call feeding on demand, which means that the babies tell you when they're hungry. It's best to avoid any kind of a time frame or a schedule. We want babies to eat frequently, and we know that they will nurse frequently in the first several weeks of life. Up to 8 to 12 feedings in a 24-hour period are still considered to be normal. And so sometimes people will say, okay, so that's about every 2 to 3 hours. Well, yes, it is if you do the math that way. But sometimes babies will want to nurse in what we call cluster patterns, where they may want to feed very frequently for several hours, and then they may take a few hours break and then pick up that kind of cluster feeding pattern again. Again, we see that very typical and very normal to be expected in the first several weeks of life. After that time, they will start to kind of develop their own predictability patterns. I don't like to say schedules because there are some babies that just never
Right?
really get on any kind of a schedule,
Yeah.
but predictability patterns where you can kind of say, okay, I know my baby likes to feed frequently at this time of day or whatever. Another big tip that I have to getting breastfeeding off to a good start is to always offer both breasts. In the early days, babies respond to milk flow. They don't necessarily understand that they're full, that they're hungry, that they're satisfied. Feeding is such an instinct for them. And so when the milk flows starts to slow down, they may lose interest in the feeding, which can often be mistaken as full or done. But they may not always be finished. They could just be not responding to the reduction in the milk flow. So I say always offer both breasts at each feeding.
So, what are some signs? So often moms come into clinic and they're like, I want to breastfeed, I want to do it. And of course, in the first week or two, sometimes there's weight checks every couple days, sometimes even every day. And so, moms just are like, how do I know the baby's getting enough? Is there something with pees or poops? Are there certain signs that a baby's satisfied or signs that a baby's getting milk that we can tell moms to look for?
Absolutely. So, again, frequent feeds are to be expected, but we will encourage moms to watch their output. That's really one of the better indicators. Um, Also, we know that babies are going to lose weight. All babies lose weight, and that is to be expected and also normal. But the frequent weight checks, the weight checks in the hospital, help us to determine that the baby is not losing too much weight. It's also important to learn for signs of, to be able to decipher what feeding looks like. Time at the breast and being at the breast does not always equal feeding. So I encourage all moms while they're in the hospital to work with their nurses, work with their lactation consultants to really be able to understand, okay, this is what feeding looks like and not just hanging out at the breast. So we want to hear swallows. In the early days, they may be kind of a little bit more spaced out, but as the milk is starting to come in, the more abundant milk is starting to be present, those swallows should be more frequent. Also, as the abundant milk is coming in, babies should be more satisfied with feeds. They should be more content with the feeds, hearing swallows, contentment at the breast, and then also peeing and pooping. Once babies are about 5, 6, 7 days old, we start to see them trend the other direction with weight loss.
Mhm.
And so, kind of my phrase that I always say is we want babies to eat 8 to 12 times a day. We want them to pee, we want them to poop, and start gaining weight by day 6 or 7, reaching birth weight by around 2 weeks. Once babies are peeing, pooping, gaining weight, I always tell moms about an ounce a day is our expected weight gain.
Perfect. Yes, and that's for us too in the pediatric clinic. That ounce a day is a good goal. So often moms come in, especially in the first couple days of baby's life, and they say, "Why isn't my milk in yet? Why isn't my milk in?" Can you talk a little bit just about like that early milk or colostrum, and kind of the difference in that, and what we think of as like regular milk or breast milk, and then
Sure.
also the typical timeline for milk to come in?
So, yes, that's a good question to ask because I get that a lot in the hospital as well. That moms are concerned that they don't have milk. Well, colostrum is milk. It's what we call early milk. It's smaller in volume, but it is very packed and full of energy and all the nutrients that the baby is going to need. Babies' tummies are small in the early days, and so the small drops of colostrum are filling for them. Babies' feeds in the first couple of days of life are about a teaspoon, and we know that is enough for those babies with that aren't having any other medical concerns. Um, we expect what we call abundant milk or milk coming in. Usually it happens between around day 3 and day 5. There are many factors that contribute to when the abundant milk will be present. But one factor that we can control is early frequent removal of milk. So those times in the first few days after birth, the more the baby's at the breast, the more the colostrum is leaving the breast, the sooner the abundant milk tends to come in. So that's why that early feeding on demand comes into play, and keeping your baby near you, because you're more likely to feed frequently in those early days. A tip also is if your infant is not really very effective at removing milk in those early
Mhm.
days, milk colostrum can also be removed by hand using a hand expression technique or with the assistance of a pump to help establish that abundant milk supply.
And I always tell moms, hand expression is such a valuable skill for any breastfeeding mom in the beginning and then sometimes later, depending on what's going on. And I always encourage moms, learn it. The nurses are trained in most hospitals, certainly the lactation consultants, to get comfortable with doing that before they leave the hospital. And again, I'm glad you mentioned milk removal because that's something too that we try to get across to moms and explain that it's really a supply and demand thing. So, if milk's not being removed from the breast, the body's getting that message that, hey, I don't need to make milk,
Absolutely.
so absolutely removing the milk so the body makes more. One of the things that I see again with a lot of moms is latch concerns, latch pain. What's normal as far as pain or discomfort? What's not normal? Can you talk just a little bit about that?
Sure, yeah. So, first we'll talk about pain. Um, Probably one of my biggest pet peeves as a lactation consultant is when I hear the advice that if it hurts, you're doing it wrong.
Right. Yeah.
Because there is some level of discomfort that occurs with breastfeeding initiation. The tissue is sensitive. The babies are feeding frequently, so to expect it to be a completely comfortable experience is a little bit skewed.
Yeah.
But pain that's lasting beyond 7 to 10 days, or pain that is accompanied with lots of nipple damage or nipple breakdown, then we might be concerned that there could be something off with the baby's latch. Um, I am a firm believer that a good latch is driven by good body positioning.
Mhm.
So, in the early days, we know that feeding is an instinct for these babies.
Mhm.
Um, and so, we can really optimize the way that the infant is going to latch by how we're holding the baby and positioning the baby on our body. It's more than just about the mouth, it's all about the
Right.
whole body and body positioning and body alignment to really achieve that good deep latch.
And it,
And go
go
ahead.
ahead. I was going to say that's another thing that I always say, while you're in the hospital, I know you're uncomfortable. And if you've had a C-section or depending on what's going on, like that can be tough, but there are multiple latch positions to try. And even though you're so tired and you may only be in the hospital for a day or so, just again, use those resources. And some of us pediatricians are comfortable kind of helping people figure out that positioning as well, but definitely using your nurses in the hospital and your lactation consultants. Go ahead with what you were going to say.
Well, I was just going to say, and a good latch is important not just for comfort, but it's also important for removal of milk.
Mhm.
Going back to the whole, establishing your milk supply and making sure that the baby is getting enough food. Um, that's all driven by a good latch. If a baby is not latched effectively, they can't effectively also remove that milk.